Welcome to the Open Adoption Project. I am Lynette Nelson, and today on our podcast, my husband Sean will be talking with Jeremy Stone. As hopeful adoptive parents, we are asked to consider a lot of things in regards to health history when we're looking at adopting. And one aspect that hopeful adoptive parents might need to consider as they begin their adoption journey is whether or not they feel like they're equipped to adopt children who were exposed to different substances while in utero. Sean and Jeremy will be talking about exposure in utero, meaning drug or alcohol use during pregnancy, and the potential effects of that on children. This is a topic that we get lots of questions about, but it's also a really sensitive topic and it can be really hard to talk about. We need to be really careful not to villainize those who struggle with addiction. I think that a lot of us have experiences either ourselves or with people who we love regarding addiction. And parents who struggle with addiction can still be loving parents, and we know of many awesome open adoption relationships where there's a party who's recovering from addiction and their presence in their child's life is a huge blessing. So to be clear, this episode is not about judgment or talking about choices that lead to these situations. In this episode, we're talking with a medical professional who's also an adoptive dad. Jeremy Stone is a fourth-year medical student, and he created a website that serves as a resource on this topic for hopeful adoptive parents who are looking for information. And the website is adoptionmeded.com. We hope that this is a helpful and informative episode. Thanks for listening.
All right, well, we are now on the podcast with Jeremy Stone. Jeremy, thanks so much for being with us.
Yeah, no problem. It's a pleasure.
Well, could you take a minute just to introduce yourself maybe a little bit and share with us your connection to the adoption community?
Yeah, for sure. My name's Jeremy Stone. I am a fourth-year medical student at Rocky Vista University. And I have two adopted daughters. My wife, Brianna, and I adopted them at birth. They're both open adoptions, done privately. Our oldest daughter is 2 and our youngest is 1 year old. They're 15 months apart. So it's very exciting right now in our household.
Busy.
Yeah. Very busy. So throughout the process of adopting and looking at potential adoptive situations, of course, substance use and different medical issues came up, as a question while we were looking through it, as well as just getting ourselves more educated about adoption. And I found that there wasn't a lot of really good resources to kind of guide us through those medical issues. And then I did have some other friends in the adoption world come across the same thing and have a lot of questions about it. And being a medical student, they came to me asking me questions about it. And so I helped kind of guide them through some of these things. And what I ended up finding was that, there wasn't any good resources. So I felt like I was in a kind of a good spot as far as being part of the adoption community, as well as part of the medical community, that I could maybe bridge that gap and create something. So I created adoptionmeded.com. It's just a concise resource to help kind of navigate substance use and pregnancy specifically, and help you to look at the different adoption situations and help you navigate that, as well as possibly what you can do in the future, that type of thing. So, yeah.
Perfect. So again, it's adoptionmeded.com. We'll put a link to that in the show notes so that the people that are listening can just go straight to it and check it out. It's a great resource. I have looked at it. I've looked through it a lot, and I've actually recommended it to at least one person and shared it with another. So go and take a look at it. But while we're here with Jeremy, we're going to ask just kind of lots of questions, medical related, that might come up in the pursuit of adopting. And hopefully this episode is just a great resource. So let's just jump in a little bit and talk about some of the maybe most prevalent, frequent questions that you hear about as far as drug usage and pregnancy. Maybe one of the first ones that I hear, or kind of in the adoption community, what amount of exposure is going to cause problems to a child if they're exposed during pregnancy?
Yeah, that is usually one of the first questions that comes up, how much exposure is actually going to be an issue or not be an issue. Unfortunately, the answer is it's really hard to know, and so there's no amount that is safe, and there's no amount that will tell you, oh, for sure you will have problems with this baby or this pregnancy or anything like that. And so we don't know the exact amount of exposure, but a lot of the substances you can kind of link to the more exposure you do have, the more likelihood or percentage that you will have a specific outcome, as far as maybe fetal alcohol spectrum disorder or, any sequela of opioid use disorder, that kind of thing. So anyway.
Yeah. And then I imagine you get lots of questions about specific substances. And we'll talk through several of those during the episode. But any thoughts related to that kind of in general?
Yeah. And I guess the first thing to say going forward, and when you look at the website, it's really hard to separate a lot of these substances, because a lot of times people will be using multiple substances at once. And so a lot of the data is conflicting and is not really straightforward, just because of that fact that there's a lot of confounding variables that come with substance use. Not only, are they using multiple different substances a lot of times, but also there's also, socioeconomic status and a lot of different confounding variables that can maybe make the data hard to interpret. And so, I do get a lot of questions about specific substances, but always keep in mind that you can't always know for sure the effects. So it's always a specific percentage or chance, of something happening.
What other questions would you say you get asked the most from like hopeful adoptive couples thinking about, a situation where this might be the case?
Yeah. So for hopeful adoptive couples, usually it's a question of, how might this affect my baby and or my family? And a lot of that has to do with, medical expenses, because sometimes what people are worried about is, what can I afford as far as if a baby's going to maybe stay in the hospital for a long extended period of time, or, what can I expect as far as long-term outcome? And so we do get that question a lot as well. And as far as expenses involved, that also varies a lot. So unfortunately, I don't have a lot of really straightforward answers for you at this point, but we'll get more of those later on. But a lot of times there's actually not a lot of expenses with just the substance uses, with the substance use at this stage. And it's mostly a matter of what the potential adoptive parents feel comfortable with as far as moving forward with an adoption. It really just comes to their gut feeling about it. So
yeah, and we'll dive into that a little bit later in the episode. So before we dive into some of the specifics, can you share just a little bit about what your mission with Adoption Med Ed is?
Yeah, for sure. Basically, our mission is to provide a basic and easily understood resource for any potential, or current adoptive parents that they can easily go to find questions about, or to answer questions about substance use and pregnancy. We're hoping to expand that to more areas of medicine and different things that people may have questions about, but currently it's about substance use and pregnancy and how to help you navigate those situations.
Great. Well, we're grateful that you've created this resource, and we're excited to see how it grows over time too. So let's jump in and just take a few minutes to discuss some of the maybe more frequently asked questions about specific substances. So maybe we'll go through a list of them, but we'll consider maybe long-term effects, what your medical advice would be to someone considering adoption of an infant that's had this type of exposure. So let's start with just alcohol in general during pregnancy.
Okay. So alcohol, the the first thing that people think about with alcohol exposure in pregnancy would be fetal alcohol spectrum disorder, or otherwise known as fetal alcohol syndrome. And that is composed of a bunch of different things as far as, you can have fetal alcohol effects or alcohol related birth defects. There's a lot of things that go into it, but the basis of it is there are certain facial features that children that are born with alcohol exposure may have, as well as usually they're what we call neurobehavioral effects, which is the effects that the alcohol has on the brain. And then later in their adolescent or toddler life, they'll have some behavioral symptoms. So that's usually what we see with alcohol exposure, but it's not like a guaranteed, if you have any alcohol exposure, you'll have fetal alcohol syndrome. And that's why it's called fetal alcohol spectrum disorder as well, because there's a whole spectrum of the different types of syndromes and the outcomes you can have from alcohol exposure in pregnancy. And so that's the first thing that people think of. With any of these substances, you're going to have effects on the pregnancy itself. And so the outcome of the pregnancy, whether it will be viable, whether, there's a risk for miscarriage, or if there's a risk for different complications with the pregnancy itself and the birth, and then there's also the question of long-term effects on the brain and the growth of the baby, right? So there are effects that can happen from alcohol on structural growth. So growth of the head, growth of the skeleton, vision, that type of thing, as well as brain development. And sometimes you'll find, a smaller head, which is called microcephaly, in some of these babies with exposure, just due to the actual growth restriction that happens with any of these substances. So that's some of the main things that you are concerned about when you're looking at alcohol.
So I think for most of these, and you can correct me if I'm wrong, but with it being a really big spectrum, adoptive parents or hopeful adoptive parents should expect anything from, no effects at all to some of the extremes that you talked about and somewhere in between. But knowing that if there was exposure to alcohol, that is a possibility. Is that right?
That's right. Yeah. You hit the nail on the head there. So you can have a lot of alcohol exposure and have anywhere from zero noticeable effects to some pretty severe FAS and other abnormalities or birth problems, that type of thing. And you can also have, one drink or very little alcohol exposure, and then also have nothing to very severe effects. So you can't really predict what's going to happen, which is why the recommendation is always to not drink during pregnancy, right? Unfortunately, a lot of times in any pregnancy, moms may drink before they even know that they're pregnant, and you never know what effect that may have later down the line. But yeah.
Okay, let's transition from alcohol to opioids. What are some of the long-term effects, and maybe, again, some of your advice to those considering adopting an infant with that type of exposure?
All right. So the main thing that people think of when they think of opioid use in pregnancy is neonatal abstinence syndrome. And this is what people typically say as withdrawal. And so a baby will have exposure to opiates during pregnancy. And then when those opiates are taken away at birth, they'll have withdrawal from those opiates. And usually these withdrawals happen within the first couple of days. Almost always it occurs within the first week. What will happen is if there's suspicion for it, the baby will be under pretty close surveillance for any symptoms of withdrawal. Symptoms can be, difficulty sleeping, jitteriness or stiffness, sweating, sneezing, fever, irritability, those types of things. So they'll be looking for those, and they can give medications to wean them off of the opioids. And typically they're there aren't very many known bad outcomes long term from that. It's mostly that withdrawal that occurs, and then after that, there shouldn't be any issues that occurs with the neonatal abstinence syndrome, if that makes sense. And so a lot of these substances will have some long-term possibilities, but most of the effects that happen with these illicit drugs is going to be during pregnancy, at birth, and just after birth. So that's the main one with opioids is neonatal abstinence syndrome. But you can also have growth restriction, some of the other things that happen with alcohol and that type of thing too.
So, but for primarily, I guess you would say that baby in utero develops kind of this addictive behavior, like body needs the opioids once they're born. With the absence of those opioids, begin to have withdrawal symptoms and then need to be treated in some way, being put on a medicine, a drug, and then weaned off of it over time.
Exactly. Yeah. So great. The body responds by, increasing receptors, that kind of thing. And so the baby feels like their brain needs those opioid receptors filled. And so that's what we do is we fill them a little bit at a time to wean them off of the drug. So, yeah.
All right, well, let's switch then from opioids to marijuana. This is probably a pretty common question.
Yeah, and this is also a very tough question to answer because there is growing evidence for some problems with marijuana exposure in pregnancy. But most of the data is pretty convoluted. It's kind of hard to parse out what is from the marijuana because, like I said earlier, marijuana or most of these drugs are used in conjunction with other drugs at the same time, right? So there's that. And typically people think of marijuana as a pretty benign, substance to use, and they don't think that it has a lot of effects. But really, the THC in marijuana, the active component, does have quite a few effects on the brain, which is why it, causes the high that it does in people. But similar to some of these other drugs, it can cause some growth issues potentially, as well as brain development. And in adults, actually, it's interesting. There's actually a high association with schizophrenia with marijuana use. There's some pretty good data suggesting that someone who uses marijuana for a while can develop schizophrenia. They haven't found that association with use during pregnancy, but there's things like that there's still not a whole lot of data yet to know whether or not it's going to have an effect. And so the recommendation is to still not use marijuana during pregnancy, right? So there are some potential effects on the brain, some of those behavioral effects, like maybe attention, hyperactivity. And the bottom line is to look for some of these signs in your baby. And if they do come up, you don't know for sure whether they came from the marijuana or from the substance, but you treat them and try to treat their symptoms as they do come up in life. But really, there's not a whole lot of proved data suggesting that there are very serious long-term or short-term effects of marijuana use in pregnancy. We're still trying to figure that out in the data. So, yeah.
Yeah, and maybe this is a good point to make this point. I think as an adoptive father, as adoptive couple, we've looked at a lot of different data about adoption, this being one aspect of that. And now I feel like there's starting to be more and more data about openness, about usage, about just tons of different things. So I'm really hopeful for the future that we can gain data that will help adoptees, right? At the end of the day, that's really our mission, to make sure that the adoptee is having the best experience possible. And so the more data we can collect over, this huge spectrum of information for adoptees, I think the better we'll be able to provide for their needs. So
yeah, exactly. The more data we can collect, as well as the more that we can distribute that to adoptive parents, that they can then use that knowledge to, help their children in the future, right? Which is, the reason why I created the website, and the reason why you're doing this podcast, right, is to distribute that and hopefully help some people down the line. And that's why I am doing research on my website. That I have this survey before and after that you can fill out, so that I can kind of prove that we need more resources like this, and we need to keep going down this path of education. So, yeah.
Yeah. So when you go to the website, there's going to be a prompt to take like a pre-visit survey. So take that and then visit the site, learn what you can, and then take kind of this post-visit survey, right? Yeah. Helps you get more information, and we'll be able to kind of form the way that you're going to add to your website, I assume.
Yeah, exactly. And just show the scientific world that, hey, there's a need out here for more education in adoption, especially in medical education specifically, that I'm looking at, right? And so, yeah, it's hopefully we can just get better and better every day, every year, and have better data out there. So
awesome. Well, I created that segue. Let's go back. Let's talk about tobacco or nicotine in your usage in pregnancy.
Perfect. So nicotine, the thing that most people think of, or that in the scientific community we think of with nicotine use, is growth restriction in pregnancy. And so whether that's growth restriction during pregnancy or just a small for gestational age baby, basically the bottom line is it can cause slowed growth. And it's actually pretty significant data showing that babies exposed to tobacco and nicotine have a much higher rate of being low birth weight, right? There's also other risks of, stillbirth and miscarriage, as well as a lot of people may have heard of the risk of SIDS with cigarette smoke. The data still says that even if your child is exposed during pregnancy and then doesn't have the exposure after pregnancy, there's still an increased risk of SIDS. I say this because of the adoption world, where you're going to be put in a different environment once you're born, right? But it's significant. From what I can tell, it's significantly decreased. Most of the risk has to do with cigarette smoke exposure in infancy rather than during pregnancy, right? And yeah, so most of the effects are going to be whether your baby grows appropriately. So if at the end of the day, let's say your baby is born, bring them home and they're healthy and they have grown well and they continue to thrive, there's not much more that you have to worry about at that point. So.
Okay. Great. And then I think the last one we'll just talk about is like stimulants.
Okay. Yeah. So stimulants, just kind of an overview. Maybe not everyone's familiar with what stimulants are. So the main stimulants that we think of are methamphetamine and amphetamine. Amphetamine is Adderall, is the common name for it. Methamphetamine is the street drug version of it. And then you have cocaine, which is the other street drug version of it. But with amphetamines and stimulants, you get a lot of growth restriction as well. The theory here is that these stimulants cause vasoconstriction, which means it narrows the blood vessels, and that means decreased nutrient delivery to the baby through the placenta, right? And so you get a lot of problems with growth restriction because they're not getting as much nutrients as they need to, right? This also means that they can have growth restriction to the brain. The brain uses and needs a lot of oxygen and blood flow. And so you can also have more long-term behavioral effects and cognitive effects down the road. And so it's not as common to have those behavioral effects, but it is a risk. And So like I said before, most of the time it's the growth problems that we're worried about. And if your baby ends up growing well and is healthy, there's not a whole lot to worry about besides looking for some maybe behavioral issues and just kind of treating them as they come up.
Awesome. So we're going to send people again to the website for them to become more familiar. It's kind of organized in the way that we've gone through, right? We look at different substances or different types of exposure that they can have, and it breaks down what parents might expect in those different situations. So I know this is kind of a big generalized question, but what type of advice would you give adoptive parents who are considering adopting an infant or child who's been exposed to different substances?
Yeah. So I'd say there's no right or wrong answer. As with any adoptive situation or potential situation, you kind of have to go with your gut, right? If you believe in God, you pray, any other higher power, try to rely on something to kind of go with your gut, because it's not all the time it's very straightforward whether you should pursue an adoptive situation or not. And so I guess that's kind of general, but every situation is going to be unique. Every any expectant mom's situation is going to be unique. Your family situation is going to be unique. So there's no right or wrong answer. But the main thing from my standpoint is that you need to just educate yourself as much as you can about specifically what we're talking about today, about the medical risks, the substance use risk, but as well as just any other issues that you might have or questions that you might have about the situation, and just try to get as educated as you possibly can, and then just go with your gut at that point. So.
I think that's some great advice. Hard to do in the moment, but just relying on maybe that intuition or those feelings that you are being encouraged or discouraged to do something. We talk a lot about open adoptions. We love open adoptions. We know that the data shows that open adoptions, for the very most part, are really positive for everyone in the adoption triad. So thinking of that, what recommendations would you give to adoptive parents who might struggle then having a relationship with birth parents because they've struggled with addiction?
Yeah, this is a really good question. So I think an open adoption can be a scary thing for a lot of people, regardless of whether there's substance use involved or not. And I think the first step is to educate yourself and kind of familiarize yourself with open adoption, what it means, what it can look like for you and your family. There are a lot of good resources, including this podcast, other online resources, panels, that kind of thing that can help you understand what an open adoption is. The adoption situations we have with my two daughters, they're both open and they're amazing. We wouldn't ask for any other way, and just it's just expanding our family. We have all these extra people to love our kids. And I know you guys have talked about this on your podcast as well, as it's just more and more people to love your kids. And we have just these, it's rocky, but we have these amazing relationships with these people, with these birth families. And I think our kids growing up, they will know, and they do know, that they're loved by their birth family and they're loved by us. And it's just an awesome situation. So having that background of being educated and being familiar with open adoption in the first place obviously helps. But when it comes to specifically substance use, I know this is kind of tough, because it's kind of like any situation that you're in where you're having to have a relationship with someone that doesn't come from the same background as you, and is very different from you. It's hard to have a really close relationship with that person if they're very different from you, right? And so it comes down to finding empathy, understanding where they're coming from, and compassion. And really, the way to do that with substance use and addiction is to understand substance use and addiction on a deeper level. And for example, when I did an addiction medicine rotation last year in medical school. And one of the things we learned was what addiction does to your brain, what some of these substances or any behavioral addictions do to your brain. And it was really interesting because what happens is that over time, the addiction takes over your fight or flight response in your brain. So your brain stem is kind of the control over your fight or flight response. It's the thing that we share with all other animals on Earth, is this brainstem, this kind of basic, living being, response. And then the rest of our cortex is what, helps us to think and navigate and all that. And so what happens is that, for example, if someone was to take your head and push you underwater and hold your head underwater, you're going to do anything possible to try to breathe. You're going to kick, you're going to do anything possible to try to get your head out of water and breathe. And that's your fight or flight response kicking in. You're not going to have reason at that point. You're going to do anything to breathe. And so what happens is it's these substances and addiction hijacks that part of your brain. There's actual anatomic differences and physiologic differences in the brain that happen. And so that when someone is addicted, their brain tells them that they need this to survive, right? And so once I understood that, I could help my patients a lot better during that rotation. And it helps me understand these adoptive situations a whole lot better, and have compassion for these people and have a better relationship with them because I understand what happens in their brain and that it's actually a physiologic problem that happens. And so just having some education and learning about how these things work can help us to have compassion and build a stronger relationship with these people, even despite the differences that we have. Does that make sense?
Absolutely. So increased compassion, increased understanding, knowledge is going to be key. And knowing that it's such a hard thing, right? Yeah, I think that that's just really, really good advice for anyone considering a potential adoption in this type of situation. If you can't see educating yourself or developing that type of compassion for someone in that type of situation, then maybe these type of situations, if and when they present themselves, you need to be able to just say, what, I don't think I can do this. Having that conversation with your spouse or with your partner, or if you're doing this alone, having really thought through what you think you can do or what you can't do, and making that decision kind of upfront so that when you're presented with a situation, then you feel a little bit more confident moving forward.
Yeah, I completely agree with that, because one thing that we learned early on is that it is okay to say no to an adoptive situation. And in this situation specifically, it's not like you're a bad person for feeling like you can't handle it, or that you're not going to be able to develop that compassion or anything like that. It's just a matter of you feeling out the situation, what you think's best for your family. And there's nothing wrong with feeling like it's not going to work for your family, and just saying no.
Yeah, and I think that opens up a lot broader conversation too with other medical issues. Having good discussions or decisions made. I remember some of the advice that we received as a couple when we first started this process was, if it could happen to you, like, could Lynette and I have a child with Down syndrome? Yeah. Would we be okay saying yes to that situation? We'd probably have to talk about that and make sure that we're on the same page as a couple, right? And so there's lots of different medical situations, or like what we're talking about now, exposure situations, where we can kind of pre-make some decisions, but that way in the moment we can rely on kind of that gut feeling that you were talking about earlier.
Yeah, exactly. And when you're just starting the process of doing your homesteading and everything and filling out that paperwork saying, would I be okay with a baby having Down syndrome or a baby having heart defects or substance use or all these different things? It's hard to kind of know at that point as well, like, especially with all the education that would really be required to know what all those things are. But, that's why it comes down, like, there's hardly anything that I would just outright say no to from the beginning without knowing anything.
Yeah.
And it really does come down to the individual situation, how you feel about it.
I love that. Good, great advice. Well, is there anything else that you would share to adoptive parents or potential adoptive parents struggling to decide whether an adoption situation might be right for them? What might you share with them?
Yeah, just a little bit, kind of how I said before, but getting all the education that you can, websites like Adoption Med Ed, this podcast, talking to your doctor, finding other resources for you. And then a big thing is to take the fear out of it. You definitely don't want to make these types of decisions based on fear, right? And so if you can do that, get yourself educated, take the fear out of it. And then, like I said before, just kind of go with your gut and pray about it or figure out how you're going to make that final decision of how you feel about it. Then I think as long as you going forward are emotionally, financially, physically prepared to take on whatever happens with this, whatever the outcome is, then I think you're okay just going with your gut on it, right? And then, like I said before, it's okay to say no. It's okay to feel like it's wrong for you, and that's really hard to do. I remember back when we were hopeful adoptive parents before either of our kids came along, and you really are just hoping and praying that someone comes along with a baby, and it's really hard to think about it and say, well, actually this isn't right. It doesn't feel right for us. And over the past couple of years, we've had to say no a couple of times, and it was only because it just didn't feel like the right thing for us. And we ended up having both of our daughters, and everything worked out how it was supposed to. And so I think just having the peace of mind that, don't make the decision out of fear, just kind of go forward and have faith that it will work out, whether it is the right situation or not, I guess.
I love that. Love that a lot. Well, any other thoughts you have that you'd like to share, or anything else on your mind as kind of some parting words on the podcast?
I think open adoption is great. And I'm really grateful for this podcast and other resources, because I think going into it as you're starting the process of adopting, open adoption is, it was hard for me to kind of wrap my mind around a little bit. I wasn't against it, but at the beginning I was one of those that was on the fence about it. I was like, maybe kind of partially open, that type of thing. But when it came down to it, when we met our daughter's birth family for the first time, we just had such a connection with them, and we just wanted more of a relationship with them. And to be honest, my wife and I have maybe wanted a little bit more from the relationship maybe than they have so far, or maybe not necessarily wanted, but we're just always hoping that we can, meet with them more, or that type of thing. And I'm sure they're probably feeling the same way, but it's just such a happy thing. And I'm just really grateful for our adoptive situations and our daughters. And I hope, your listeners will agree and keep looking at open adoption as, such a good thing.
Awesome. Well, Jeremy, thanks so much for being on this episode. We really appreciate you and taking your time to share with us, and for all the time you've put into creating your website. Again, we'll point our listeners there, but just thanks so much for all that you're doing.
Yeah, no problem. It was nice meeting with you.
Thanks.
Thank you so much for joining us for this episode of the Open Adoption Project. Make sure to check out adoptionmeded.com for more information about exposure in utero, and a big thank you for Jeremy for talking with us. We'll be back next Monday with a new episode. We'll be sharing an interview with a birth mom who has a very open adoption with her oldest child, and we are so excited to learn from her. Check out openadoptionproject.org for more information about our podcast, and we'll be back next week. Thank you so much for listening.